So here's a question for you. Are you mentally ill if you refuse to get the vaccine? Well, the biopharmaceutical complex, working in lockstep with Western governments, appears ready to prescribe medication, psychiatric medication, to people that might refuse to get the vaccine. I know this sounds absolutely crazy. Let's start with Canada. During an interview at the Let Freedom Reign tour, bunch of good interviews that came out of this tour, by the way, physician and cancer researcher Dr. William Mackis, who's been sounding the alarm over mandatory vaccines, and he's particularly been sounding the alarm over what's been happening to doctors in his field after they've undergone mandatory jabs. He claimed that the College of Physicians and Surgeons of Ontario sent out a note to doctors implying that their unvaccinated patients may be suffering from a mental illness and should be prescribed psychiatric medicine. So listen to this, watch.
I mean, there is a definite assault against the unvaccinated, and you've talked about how even they recommend, you know, perhaps psychiatric medication or something for people that don't want to take a vaccine.
So this has come out recently out of the College of Physicians and Surgeons of Ontario. The college sent out a letter or a memo to all the doctors in Ontario suggesting to them, now so far they're not mandating it, they're just suggesting it, that any of their unvaccinated patients, that they should consider that they have a mental problem and that they should be put on psychiatric medication. So far, it's just a suggestion, but the College of Physicians and Surgeons of Ontario should not be making these kinds of suggestions. This is extremely unethical, and this is a very, very slippery slope. If they're suggesting that people who wish to have bodily autonomy and don't want an experimental vaccine, that there may be something mentally wrong with them, that is a very, very dangerous, slippery slope that we're on.
It's unbelievable. So that's the actual memo. So what I want to zero in on, of course, is the last paragraph down here. So let's zoom in on that and the next slide, which says, it's also important that physicians work with their patients to manage anxieties related to the vaccine and not enable avoidance behavior. For example, for extreme fear of needles or other cases of concern, responsible use of prescription medications and or referral to psychotherapy may be available options. Overall, physicians have a responsibility to allow their patients to be properly informed about vaccines and not have those anxieties empowered by an exemption.